welcome to the Gender Community of Practice and Youth Engagement Joint Community of Practice meeting for YouthPower to Learning and Evaluation. We're really pleased to have you join us today. I know that many people are very busy and spring is coming, and so we're all gearing up for some vacation as well. But thank you for joining us today. We have two really wonderful speakers who will be speaking to us about gender and post-pandemic recovery. So I'm very excited to have them, and I'm sure you are too. As you're coming in, again, just a reminder, please put your name, organization, and where you're based into the chat as we go. So I am Heather Marlowe. I'm a senior research scientist at the International Center for Research on Women, ICRW. And I am the Gender Community of Practice co-facilitator, along with Sheila Salim, my colleague based in Kenya. And we are also working with the co-chairs from the Youth Engagement Community of Practice, Apurv Jain and Balkis Shaban. They can introduce themselves later in the call. So I'm going to start off by reviewing our agenda. And then we will move quickly to our speakers. And just a few reminders as you're coming in for mutual respect and putting your name in the chat, and we'll ask everyone to put your questions into the chat, and we will answer them later in the call. So to quickly review our agenda, first we're going to start with a quiz, which should be a bit of fun. And then we have our two speakers. First, Shuba, who's a program officer from the Bill and Melinda Gates Foundation. And then Catherine, who's a global health consultant and Pan-African feminist. As I mentioned earlier, we will have time for question and answers after the two presentations, so please go ahead and put them into the chat as they occur to you, and we will get to them towards the end. And then we'll do a quick exercise about your involvement in Generation Equality Youth Forum moving forward, and conclude with a few remarks. So with that, I'd like to go ahead and hand it over to Balkis for a short quiz.
Thank you, Heather. Hi, everyone. So happy to be here and see all of you. My name is Balkis. I'm from Tunisia, and I'm the youth advisor for the Youth Engagement CoP. And now we're going to have quiz time, which should be fun. We want to get to understand and know, about your backgrounds and where you're coming from, your age and everything. So on the screen, you're going to see a poll that will ask you three main questions. Where are you from? What is your age? And what is your occupation? So again, where are you from? What is your age? And what is your occupation? You should see it on the screen. Please select what works for you. We'll give you a couple of seconds to do that, and then we'll share the results with you. Okay, awesome. So we have a tie between Africa and North America. Most of the people here coming from there. We have a couple from Asia, the Middle East, which is really good diversity in the call. We have also very interesting and diverse age groups. As you see on the screen, most are between 31 to 40, but we also have 21 to 30 and also 41 to 50. And most of you guys work in the international nonprofit sector. There is also a couple from the private sector and the governmental, and those who also work as consultants. Awesome. Thank you so much, guys, for voting on that. It's a really diverse group, and we are really sure that this conversation is going to be very interesting. And now I'm going to head it over to Apurv, my colleague, to start with the presentations.
Thanks, everyone. Hi, my name is Apurv Jain, and I'm the co-facilitator for the Youth Engagement Community of Practice. And as Heather said, that this is a joint event between the two communities of practice, which are part of the YP2LE network. I will very shortly introduce the YP2LE network. It's a learning and evaluation network for youth and youth serving practitioners who are interested in advancing positive youth development. Please do sign up to www.youthpower.org and create a profile and join our communities of practice so that you can connect with a global network of professionals working on youth and young people's issues. I'm really excited to welcome our first speaker for the webinar today. Could I have the next slide? Um, so yes, so we have Shubha Jairam, who's the program officer for the Melinda Gates Foundation's Gender Equality Division, where she leads work to develop evidence on women's collectives and group models to empower adolescent girls and young women. Prior to joining the foundation, Shubha was actually leading one of the communities of practice as her role as the program director at Results for Development, really providing leadership for a portfolio of projects focused on improving youth employability and education. She has more than a decade of experience in global development consulting, project management, strategy development on socioeconomic empowerment and livelihoods. She holds a master's in public policy from the Harvard School of Kennedy and bachelor's degree in economics and international relations from Tufts. Really, really happy to have you here with us, Shubha. Um, we can have the next slide.
Wonderful. Thank you. Thank you so much for the really kind welcome. And thanks to all of YP2E and the two COPs really, and Apurv and Balkis and Heather and Sheila, all your work in really putting this together. So thank you for that. I'm pleased to be here today to share a little bit, as Apurv said, about our work on the gender equality team at the Gates Foundation and how we are trying to ensure that gender is central to the economic recovery going forward. And my role specifically within our team, as Apurv mentioned, is a mix of strategy-oriented work in shaping and managing investments related to research and learning around women's groups and girls groups. So maybe the next slide. Super. So first, I wanted to share a little bit about our gender equality strategy within the foundation. So as some of you may know, our GE strategy was officially launched in 2018, and GE became a division within the foundation just last year in 2020, with Anita Zaidi as our president. And our gender equality strategy uses a cross-cutting approach. And this is within our programmatic work specifically, we are focused on girls and women's economic empowerment. Women's economic empowerment, as we refer to that acronym. And our focus first is on removing the barriers and strengthening women's work and enterprise. And we support the work of partners to break down the structural barriers that women and girls face simply because of their gender. So for example, trying to understand the barriers and solutions to address affordable childcare, or how do you tackle labor market segregation? Second, we're also focused on empowering women and strengthening platforms such as women's empowerment collectives, WECs, as we call them, that build their voice and agency and support their economic empowerment. And so next slide. And so you can see, building on what I just mentioned, our programmatic strategy is focused on 3 core outcomes. And you can see those outcomes on the left-hand side of the screen. Namely, access to income and assets, control and benefit from economic gains, and power to make decisions. And those are our ultimate outcomes that we are trying to hit through our WE strategy. And we believe that women's economic empowerment and gender equality is fundamental to accelerating progress and fundamental for increased equality, reduced poverty, and really seeing those intergenerational effects. Next slide, please. And so with that brief context on our gender equality team and on our GE strategy, let me shift to today's topic, which is really focused on COVID and recovery. And so, as I think everybody on this call knows, COVID is not gender neutral. And for 20 years, poverty level among women had been falling. And with COVID, we're seeing a reverse, and poverty levels are now rising rapidly. And a report from UN Women last year shows that the poverty rate for women was expected to decrease by 2.7% between 2019 and 2021. But instead, projections are pointing to an increase of 9.1% due to the pandemic and its fallout. And so you can see that COVID has exposed the weaknesses and worsened the pre-existing inequalities. So for example, women-owned firms and female workers are disproportionately concentrated in the informal sectors, which lack social protections and which have been particularly affected. Data also shows that women in most countries are currently spending more than 30 hours per week on childcare. 30 hours a week, that's almost the equivalent of a full-time job. And then you can see the data on the bottom of the screen here. And there's other evidence from the past year that sheds light on the other impacts of the pandemic. So for example, the consequences on livelihoods, education, food security, unpaid care, as well as violence. And so this data that you can see in the last 7 bullets, this is from research conducted by ActionAid across India, Ghana, Kenya, and South Africa. And the numbers are just striking. For example, 80% of young women who are studying have been unable to continue their education due to a lack of appropriate technology for remote learning or because of an increase in household work. Meanwhile, more than half, 58% of women, believe that women and girls have become more vulnerable to violence during the lockdown. They were forced to, for example, spend more time with their abusers at home and found it more difficult also to seek support. So this data paints a very, very stark picture and reinforces the urgency of action and the need to ensure that gender is central to recovery plans going forward. Next slide, please. Thanks. So this brings me to what we are doing across the foundation. And one of our key priorities on the GE team is to ensure that gender is core and central to the economic recovery. And I'm speaking really on behalf of our team at the foundation. So if anyone is keen to follow up on details, happy to make the connections or point you to specific research that I'm going to be mentioning. So first, you can see on the left-hand side, we're working very closely with our partners to build the evidence on the pandemic's impact. We're working to understand the gendered impacts, how and why women are most susceptible, and to generate evidence and test and scale solutions. And so you can see in the middle on the slide a snapshot of a few of the many partners that we're working with. Second, and you can see that on the box on the right-hand side, we're working with international financing institutions and civil society organizations to ensure that policy is gender responsive and that we're really using this moment as an opportunity to reshape entrenched gender unequal practices that were unequal long before this pandemic. And I'll give you some illustrative examples of what we're doing and a few of the priority areas we're focused on in the next few slides. And lastly, you can see across the bottom, we're also integrating a gender lens across our response to the crisis in other divisions at the foundation as well. So really integrating gender throughout our work at the foundation. Next slide, please. And so very briefly, I wanted to share one example of how, together with our partners, we are generating evidence on the impact of the pandemic on some key areas and identifying solutions and policy responses. As part of an evidence brief series, we're focused on a rapid sprint to distill evidence on 5 key topics, and I'll briefly be covering all 5, and putting forward recommendations to inform policy and programming going forward. 2 of these evidence briefs, the ones you can see here on the screen, specifically on gender data and childcare, are now complete and available online on the gender equality page of our website, and happy to pop the link into the chat after. So very briefly, our gender data brief, it's co-authored by 10 of our partner organizations. And the partners really make clear how the pandemic has exposed and worsened existing gender data gaps, particularly around health, education, and economic opportunity. And these undermine our ability to craft gender responsive policies and programs. And there's an urgent need to address these gender data gaps and collection obstacles in order to fully understand and mitigate the gendered impacts of the pandemic. The second brief is on the childcare crisis. And I think many of us on this call are likely fully aware of this crisis, but just to paint some data on sort of the extent of this, This brief is co-authored and supported by 5 organizations, and it makes the case that childcare must be addressed within our COVID-19 recovery plans, both to reduce the burden of care and because it allows more women to work. And like I said before, the childcare crisis is not new, but the pandemic has highlighted and worsened this crisis. When schools were closed, women took on the brunt of extra childcare, and the most marginalized women, low-income women, women in the informal sector, single mothers, adolescent girls, those were the hardest hit by the childcare burden. Meanwhile, the female-dominated childcare sector risks completely collapsing as a result of lockdowns, rising poverty, and the ability of people to pay for services. So far, the fiscal stimulus and relief packages have largely failed to address unpaid care, including childcare. In Africa, for example, only 4 out of 113 gender-sensitive COVID-19 response measures have tackled unpaid care, only 4. Both briefs are a call to action. They consolidate evidence, highlight exemplars, and provide recommendations for policy and programming. Next slide, please. The forthcoming 3 briefs are focused on women's empowerment collectives, informal work, and small and medium enterprises. The Women's Empowerment Collectives briefs will be focused on WECs, Women's Empowerment Collectives, women's groups in Africa, as well as in India, and will be released next month by our partners through a webinar, which will be co-hosted by CEEP and the Evidence Consortium on Women's Groups. So do sign up on their website if you're interested. And as I said before, all of these briefs will be shared publicly, so please do use them as resources going forward. Next slide, please. And lastly, just before I wrap up, I do want to take this opportunity to mention a key upcoming moment to amplify these messages, which many of you may already in fact be aware of. The Generation Equality Forum is a multi-stakeholder initiative to accelerate progress for gender equality. It's in honor of the 25th anniversary of the Beijing Women's Conference, and will now be happening next week in Mexico City and in June 2021 in Paris, with a combination of in-person and virtual gatherings. There are 6 thematic action coalitions, including on economic justice and rights, as well as on gender-based violence. And adolescent girls and young women are a central cross-cutting theme throughout all 6 action coalitions. This is an important opportunity to amplify key messages and drive action. And I'm thrilled that Catherine is here with me. She's really leading the engagement with Jeff, the Generation Equality Forum in Kenya, and will be sharing more about this in her presentation. So with that, let me just say thank you again, and happy to answer any questions.
So this is Heather, and just a reminder to please go ahead and put your questions in the chat. And why don't we move to Catherine's presentation, and then we will address all questions after both presentations. So great. Well, I'm pleased to introduce Catherine Nyambura, who is a global health specialist and international development expert and Pan-African feminist. She's worked on sexual and reproductive health and rights and women's rights, adolescent health, and HIV/AIDS as a consultant for many different global development organizations. You can read a bit more about those details in her biography. She works as an independent consultant and is currently the lead consultant for the Generation Equality Forum in Kenya, as we had mentioned earlier, for the International Center for Research on Women. Catherine is also a 2016 Mandela Fellow. She was a 120 under 40 winner and named one of the 5 young African change makers, among many other accolades and accomplishments. So we're very pleased to welcome Catherine. Thank you.
Thank you so much, Heather, for the introduction. And thanks so much, Shuba, for setting context in terms of what's happening with the pandemic. So I hope everybody can hear me. So I'll try and be loud. Thank you. So in terms of my presentation, I'll focus a bit more of a deep dive in Kenya and then just set the context regionally across the continent in terms of Africa, and then just go later to articulate some of the opportunities. And so for Kenya, we do have a significant percentage of the population being young, and in particular, those that's comprising quite a majority of adolescent girls and young women. And so with COVID-19, as we know, as Shuba has articulated, we do have an increase and exacerbation of gender inequalities amongst other forms of inequalities. And so part of my role with the GF consultancy role, but also with my other hats, is to I've joined the COVID. There's a research being put together by Population Council and the Office of the President, just to attempt to understand the extent of the inequalities and the impact of COVID-19 on adolescent girls and young women. And so I wanted to share some of those findings in terms of specific issue areas, and then to narrow in on what forms of GBV adolescent girls and young women are experiencing, and broadly on the continent what this looks like. And so this first slide was focusing on the background, and just to give you a sense of some of the broader challenges adolescent girls and young women and women in general in the diversity and gender diverse people are facing. And so first of all is from the research, and this is a multi-site preliminary findings, is that there is report of increased violence, including emotional violence, physical violence, sexual violence, and the percentage increase is quite significant. And the baseline information is pre-COVID results. So this is just showing the amounts of the percentage increases during COVID. And then we do have quite a significant number of adolescent girls and young women who report not being able to access services, HIV services, recharge services, and other kinds of services. And just to note that for the sample size of the study, there was a significant number of adolescent boys as well who are sampled, and so that should be around 15%, but still significant to show that generally there are challenges amongst adolescent girls and adolescents, but mostly for adolescent girls and young women. And then there is challenges accessing menstrual health, menstrual hygiene products, and that mostly can be attributed to some of them are accessing that through schools, and now schools are closed, and due to economic strains at home, it means that parents have to prioritize food over over pads, quote unquote. And so just to give you a sense of some of the challenges that the research is unearthing as affects adolescent girls and young women. I'm on the next slide already, so if we could move, please. So that's the information in terms of violence, in terms of health care seeking behaviors, in terms of menstrual hygiene, in terms of mental health, of course, amongst a myriad of other research finds that have already been unearthed at the preliminary level. So if we could go to the next slide as well. Yeah, so this sort of resonates with what we've had from media and from other sources of information, that there are increases in teenage pregnancy. I think as of last year around the country in Kenya, there was quite an uproar around the number of adolescent girls presenting at healthcare facilities who are pregnant, and that's just to not count the ones who are not presenting, because as we've seen in the research findings, there were quite a few girls and women and also boys who are unable to seek services due to various barriers. And also we've seen increase in various forms of gender-based violence in countries like South Africa. The report in terms of the increase in reporting was over 100-fold. In Kenya, through the GBV sector working group, the numbers are also they're really high as well. We've seen increase in harmful prevalence in harmful practices like FGM and child early forced marriages. And so in Kenya, we do have what we call hotspot counties. So those are like subnational governments where there was not just an increase in FGM, but also child marriage. We know that mostly when FGM happens, the precursor to child marriage, and due to the long time, the amount of time that adolescent girls and young women were out of school, it meant that the cushions and the shock absorbers were really removed were really removed from the ecosystem, and so it meant that they were much more exposed. And just generally due to supply of the collapse of global supply chains, it means that adolescent girls and young women are not able to access SRH services where, like contraception where they need, information, and many other, even those who are living positively with HIV were not able to access their ARV top-ups and things like that. So I think it paints a picture of what happens in reality in Kenya and beyond, with some support with data, as Shuba has mentioned, and with the research I was articulating. And then moving to the next slide, please. I think now there was I think that in many countries, there was quite a report in terms of the movement restrictions, particularly related to COVID-19 containment measures. There were certain groups of young women who faced much more risk more than others. So as I mentioned, adolescent girls and young women living with HIV, for example, are unable to access their treatment. Those who are living negatively and are at risk, and are unable to access HIV prevention services and SRH services generally. And those for whom risk is amplified, like LBQ women, they face much more violence because being contained at home with not so friendly family settings. Due to crackdown, for example, there are women, particularly young women who have small scale businesses, for example, and due to curfew, some of them are exposed to police brutality. And I think we see how some of the violence may have been intimate partner violence, but there is also an element of increased structural violence during COVID, and this was reported in different forms. And also I wanted to articulate the ways in which the way the society is set up, a lot of the support mechanisms were outside the homes, so support groups, one-stop centers, healthcare facilities where there are youth-friendly corners. When COVID shut things down, it meant that the support systems were broken, and this was disintegrated in terms of where adolescent girls used to find spaces, and even women generally used to find spaces to report GBV. They didn't have the response or prevention mechanisms that they used to have, and avenues. And so this means that not only did GBV increase, also the avenues for response and prevention also dwindled. And initially, we know that when governments were providing measures and containment guidelines, not so many countries had initially integrated GBV response and prevention services as essential services until March led into the pandemic. And so I think we've learned much more now after the pandemic 1 year later, but I think it's important to just show the impact of inaction or some of the disintegration at the beginning, the cost it had in terms of GBV. So please proceed to the next slide. Thank you. And so some of the gaps that we had in terms of COVID-19 response was in many task forces. If you read the CARE report, there's a CARE report that was released last year. Most of the task forces did not have gender equal representation in terms of leadership. So it meant that perspectives of women and girls were missing in terms of articulating the policy response and even programmatic responses at the beginning of the pandemic. A lot of the responses were quite gender blind, and as Shuba has mentioned, very few are gender sensitive at the beginning, and even later on when they were gender sensitive, they were not transformative or responsive to the ways in which the pandemic was affecting women and girls' lives structurally. Right, most of them will address social protection at a very basic level in terms of state taxation, but not thinking of how women have to now work at home and from home. So their productivity was quite limited, even for those who still were able to maintain their jobs. And so we did not see governments at the beginning responding transformatively, and most of them are not even sensitive at the beginning. So that came on much later, and after quite a push from areas like UN and others. And also the other point was a focus more on economic recovery, which lacked a gender analysis, such as the heightened burden of unpaid care work, or the ways in which the pandemic was causing a recession as opposed to just a recession generally. So we know that the first jobs to be lost were women's jobs, for example, which are at the bottom of the pyramid, the most precarious jobs and the most informal jobs. And so there was not so much focus in terms of how gender the epidemic was unfolding to be. And then initially, as I mentioned, not many countries had listed GBV response and prevention services as essential. So we had quite a few gaps in the COVID response. Next, please. But I think just focusing on gaps is not enough. It's good for us to think of the opportunities. So I think initially we did have a few governments and a few countries just think through of what such a protection measures would look like, including adopting policies to combat increase in GBV. So for example, during the pandemic times last year, Kenya adopted what they would call an interagency program on GBV that mandates GBV response across the ministry, just beyond the gender ministry. So the Ministry of Interior, Ministry of Health, Ministry of Justice, and many others. And so we did see a few governments think through what it means to be transformative and responsive later on, of course, but it happened. And some had quite specific responses, like having listing GBV response and prevention mechanism avenues as essential, and a few trainings for police to be gender responsive and to be able to respond to GBV during COVID, and I hope beyond. From the African Union, there was a very specific guideline on what gender responsive responses to COVID-19 look like, and they covered areas from education, economy, food security, peace security, legal protection, decision making. So very specific ways in which the government, the African Union was providing a template and a tool for African governments to ensure that their COVID-19 response plans are gender responsive and are taking into account the lived realities of women and girls in the diversity. And now I'll just speak a bit more on the Generation Equality Forum process. So Kenya and other Action Coalition leaders and other stakeholders are part of the GEF process, where there are 6 thematic focus. There is one on GBV, so I'll focus on that. So on GBV, we've seen the Action Coalition produce some very robust priorities, for what a response to GBV and actionable commitments would look like if you are to end GBV and possibly have some progress in the next 5 years between 2021 and 2026, and I'll share what those are. And also the GBV Action Coalition and other action coalitions have a mandate and a focus to ensure that there is actionable commitments that also address the needs of adolescent girls and young women. And so some of the commitments we are seeing from the GBV Action Coalition includes an enabling policy and legal resource environment for the elimination of GBV. So thinking of how we can be making our GBV, making sure that countries have GBV response laws. Not all countries do have domestic violence laws. Not all countries do have up-to-date policy and legal environment. And not all of these are benchmarked to global standards, for example. And so ensuring, so the GBV Action Coalition has 4 sub-themes, and one of them is on the policy, legal, and resource environment. The second one is on adapting and scaling up evidence-driven prevention programming. So to ensure that, I think as we focus on response and the policy environment, we also focus on prevention. And then we do have another point around ensuring comprehensive, accessible, and quality services for survivors. So focusing on prevention and also response as well. And then finally is a sub-theme and focus on ensuring that the women's rights organization, those working at the front line to respond to GBV are well resourced. So a very strong sub-theme and focus on resourcing women's rights organization and feminist movements. And so for the sub-themes, I think they will be like the 4 flagship broad policy programs and platforms that will drive the work of the GBV Action Coalitions, and the framework on which the Action Coalition leaders and later the other commitment makers will be anchoring their work to ensure that at least the Beijing +25/26 review does take into account the urgent needs and what needs to be done globally, of course, to accelerate response to GBV. So I'll stop now. I think I've taken much more time than I was planning, but I also want to ensure that we have enough time for discussion and question and answer. So back to you, Heather. Thank you. I hope you are able to hear my presentation. Thank you. Over.
Yes, thank you so much, Catherine. We were able to hear your presentation, all of your very interesting and engaging work. And we will now move to the question and answer phase. So I'm going to hand it over to Balkis and Sheila.
Yeah, thank you, Heather. Sorry, my camera is off. My internet is really unstable. Can you guys hear me? Okay, great.
Yes, we can.
All right, so we have about 10 to 15 minutes at most for the Q&A, and I know we have 2 questions in the chat. I'll go over them, but because it's a small group, moving forward, if you guys want to ask the question yourself, you can raise your hand and we'll make sure to unmute you. All right, so we have a question from Lisa. She said, what were the social media virtual opportunities for outreach for marginalized adolescents and or women in general as face-to-face spaces dried up? And I'm guessing this question maybe can go to Catherine.
Yeah, so I can respond to that. I think when the physical spaces shrunk and were unable to, were inaccessible during COVID, we did see a lot of adolescent girls and young women repurposed and reorganized using WhatsApp groups, for example. I'm part of a few of them. And what's happened is, I think for me, beyond that being an avenue for adolescent girls and young women to interact, it also demonstrates the work, the very invisible work that mostly youth organizations do that does not get elevated or scaled up into like formal structures, formal granting, because it's very difficult for us to see to have conceptualized the importance of WhatsApp groups as community systems and frontline response elements for adolescent girls and young women. You will see adolescent girls and young women come in to ask, okay, how are we and accessing how for some of the networks I'm part of, some of the feminist networks I'm part of, adolescent girls, for example, would pull together and have one of them, if they live in the same area, to access medication for those who are living positively, for example. And for others, you're able to share a response. For example, when Kenya was having the 1195, the number was not very accessible to everyone. And when GBV was rising, circulating that number in WhatsApp groups was quite important, just for people to know you can call this number when you need to. And even asking who has a contact with this person I'm trying to call and I'm not able to access support. And so I think my point and my response is we went back to the basics, leveraging technology now, but really utilizing mechanisms that in the past may have been invisibilized, because we had sort of not understood the ways in which programming scales up and the points at which things start. That's what I think. It starts with human interaction. And I think adolescent girls and young women and young people generally have found ways of staying connected. And that did prove to be quite a strong, solid support system during COVID-19.
Just to add to that, Catherine, if I may, I fully agree. And I think this is also what we are seeing through our work on women's empowerment collectives, WEX. And so, like you said, we're also seeing how digitization has allowed groups, women's groups, even though they were not able to meet for some time in the crisis, they were still able to connect with each other. Mobile money allowed for some access of savings, etc. But I do also want to make the point that something we've heard is that digitization also leaves behind the most vulnerable women. So I think what's been particularly challenging, whether you're a woman or say an adolescent girl trying to have access to schooling materials and such, some of the most marginalized don't necessarily have access to that digital technology. Both in terms of not having access, but also because they may not be allowed to use it in their household. They may not know how to use it, etc. So I think that's another consideration on this piece.
Yeah, thank you, Shubha, for that. So Apurva and I thought maybe if Nafisa and Susmita, I hope I didn't butcher that, would you like to raise your hand and then unmute yourself to ask your question, just so that we make it more interactive?
Yeah, sure. I can go first. Sasmita here. So I wanted to understand, Shubha, from your point on like mainstreaming a gender lens in other sectors as well in the COVID response plan. So how do you do that? What are some of the strategic ways in which other sectors who have conventionally probably who have not focused as much on gender can mainstream that lens in their budgeting process or even in their implementation plans? How do they do that? If you could just share a little bit around. Thanks.
Thanks. I think that's really a key question, right? Which is how do we make gender everybody's business? And how do we stop seeing it as something that sort of happens on the side, but really gender is central to what we do for the sort of more holistic response, and also to ensure that we are able to really progress from this crisis. And I think that's key, which is how is it sort of integrated part and parcel into all of the responses. And I think specifically in terms of some of what we're seeing, maybe I'll offer you a few examples in terms of, say, childcare. So something that one of the recommendations really coming forth from the childcare brief is how do you sort of ensure that paid care work is rewarded? And how do you provide and promote more paid care work for childcare workers? And that involves, for example, governments increasing public financing, but also, say, a greater private financing for the sector, and increased, say, income support for both center-based workers, so childcares, creches, etc., as well as domestic childcare workers. And I think sort of recognizing that and sort of rewarding that is a key piece of it. And I think maybe my second point related to that is again, maybe looking at the childcare sector specifically, but how do you sort of ensure that, say, childcare workers' rights are guaranteed? How do you promote that dialogue? How do you strengthen, say, rights to collective action? And I think that begins with policy measures coming from the government and sort of guaranteed by the state, but then also sort of cultivating that buy-in and support from others as well, is really making what's previously unrecognized and unseen, seen and recognized. And this is specifically in terms of childcare. Did that answer your question? I know that was a very specific example.
Yeah, I know to some extent, yes. From a childcare perspective, I do understand, but I think something we really struggle with is to bring a gender lens as a central focus to projects that, say, are to do with, say, food or water or even energy for that matter. And when you talk about gender there, oftentimes the conversation is just limited to, can we provide more livelihoods to women? But beyond that, getting into aspects of how do we intervene in a way that we can probably impact other aspects. And for that, when you have to go into things like social protection, childcare, working with men in the community, etc., that kind of interest and that kind of financing is not available. So what does it take for donors and implementers to move towards that thinking is something that I think a lot of us in other sectors would really benefit from learning about.
Yeah, maybe just to add on to that point, fully agree and happy to share some resources, or at least how we are thinking of doing it and how we are doing it in the foundation. Apologies. But what we are trying to do, exactly to your point, is how do you ensure how gender plays into all of the issues you're working across, like you say, whether it's in agriculture, whether it's in water sanitation, whether it's in health, etc. And so we are more intentionally taking that gender lens across our own investments. So we're doing that through, say, guidelines, toolkits, etc. And we're now using what we're calling this investment marker. And so really trying to force ourselves to ask questions such as, how do women and girls experience the challenge differently? And what constrains access that women and girls may face in particularly trying to access something. So for example, it's not sufficient to, for example, looking at WASH, it's not sufficient just to provide, say, public toilets to women. But how do you take into account the unique needs of the women, say, in accessing toilets? And so that really starts with a gender analysis at the front, and then really trying to understand how can you apply that analysis and how can you apply that lens to understand how the specific constraints that women and girls may face and the barriers they may face, and how do you counter that? And if helpful, happy to share some of our tools and resources related to this piece around gender integration and how we do that across all sectors.
Thanks. Yeah, I think that will be helpful because there we are talking to an entire group of people who don't think about gender the same way. So it's like you have to convert them first and then get into like far more detailed steps of implementation. Thanks. That will help.
I could just mention my comment. I don't want to derail the conversation away from gender-based violence, but I did want to ask Catherine if she had any opinions about how COVID-19 is sort of highlighting the value or importance of talking about online gender-based violence, even though issues of access are still a huge issue. But I feel like more people are recognizing online gender-based violence and how the particular nature of targeting women, girls, and non-binary people online have sexual violence involved when it's sort of online, and if that's sort of part of our frameworks now.
Yeah, so I think increasingly that COVID-19, beyond the challenges it's presented, it also expanded some of the conversations. For example, I think we've had a renewed focus on GBV, one because of the scale, but also because governments have been compelled to respond really when you do see the unprecedented statistics and the unprecedented parallel epidemic it's becoming. Similarly, for technology-assisted violence, I think for a long time, there wasn't, I think the clarity of women engaging online, people weren't clear the levels of violence women are facing online. And now having to work virtually and all those Zoom bombings in professional settings, while it takes such shockers for governments to respond, I think there's been quite a spotlight, and we've seen governments develop frameworks around this. I think the only challenge is that in many ways, some of the frameworks have not been as gendered as we want them to be. So most of them have been, as opposed to some of them have been quite a catch-22, where they're also criminalizing online engagement for women human rights defenders, for example. So depending on what context you're working and how governments are responding, it's such a delicate balance, right? So in many countries, an overly securitized approach sometimes can limit the civic space that the online space has provided for youth organizers. But to your question, yes, there has been a focus on GBV in online spaces. Of course, recognizing gender digital divide, it's been there. But I also think that the COVID-19 has also elevated the need and the policy attention to gender digital divide itself. For example, we've seen many much more donors allowing data stipends to young women as part of the work, repurposing travel grants to provide data stipends as part of grants that people have been doing. So have been provided for. And so I think it's a much more expansive and robust conversation, which has both pros and cons in terms of the ways in which governments respond. But I do think that there has been a focus on so many forms of GBV, even harmful practices, child early forced marriages, FGM, intimate partner violence, very specific forms of violence facing gender diverse persons. I think there has been quite reporting, and even just on the ground frontline response work done by community groups did help to provide the data. It may not be the official data from government, but just to see the levels across and the prevalence across the world and how that's shaping up in different countries. So I hope I didn't go off tangent too much, but that's my response.
Thank you very much, Catherine. We also have another question from We have one question from Maria, and the question is, are there specific reports that focuses on technology and gender related to COVID? So I think both of you can answer these questions. So I'll repeat it again. Are there specific reports that focus on technology and gender related to COVID? So we could start off with Shuba.
Okay, Shuba can start.
Sure. I am happy to have a think. I think technology and the sort of constraints play a key mind. I guess I'm not sure what piece you're speaking about, because I think there's a lot around technology. I think, for example, there are guidelines, there are resources related to, say, digital cash transfers and sort of how your digital cash transfers are now being used increasingly. So happy to share that. But then I think maybe you're meaning more potentially the digital divide related to COVID. So happy to think some more about that. But maybe Catherine, you have some thoughts.
Perhaps just to clarify, so yes, you're absolutely right. I was thinking more about, especially when Catherine was talking about, the use of WhatsApp and how that may have actually helped some groups. So I was just wondering if there were any recent reports that might already have looked at either how technology has helped overcome some of the issues that have been encountered in terms of either gender-based violence or or kind of decreased access to solutions about it, and if there's anything that would have specifically looked at either how the lack of access to these technologies may have perhaps exacerbated some of the impacts of COVID. And it may just be too early still for some of these reports, but would be interested to see if there's anything that's related to that.
No, I was going to add that I think the blueprint coming out of the Generational Equality Forum next week from the Technology Action Coalition does have a focus on GBV, and that will be a good blueprint to look at. I think at the Mexico Forum there will be some preliminary blueprints released, so it will be good just to see how the Technology Action Coalition, for example, will be articulating GBV, because it's been one of the central discussions there, how technology can be an enabler of GBV, but also can be used to mitigate and prevent that. And I'll also look for reports from some of the networks I'm part of and see if they've particularly documented the COVID-related 19 GBV and or access issues that due from their work. So I'll try and look. And I know the Athena network that I'm part of sometimes does a lot of online work and engaging adolescent girls via technology. So I'll see if I can pull reports from there. Thank you.
Thank you very much, Catherine. And we'll also be able to share the reports also in the community of practice groups in the forum. So we also have one last question I'll take from Lisa. The question is, to move the needle, how are boys and men being included in both knowledge, stroke awareness, and to be part of the solution? So I think this question is focusing on male inclusion. So probably just a take also again from both of you to answer that question on male inclusion. So I'll probably repeat the question. So the question from Lisa is, to move the needle, how are boys or men being included in both knowledge and awareness to be part of the solution?
Maybe I'll just say that I think it's absolutely critical to sort of shift social norms and sort of shift some of the attitudes that sort of exacerbate some of these gender inequalities. And so I do think, it's critical to include them. I think your question as to how men and boys are being included in knowledge and awareness, maybe what I can say is, some of what we're seeing, for example, going to, say, childcare is sort of, how do you shift that norm? And it's a question, right? Because I think this predates the pandemic. I think this is a larger problem, which is sort of, how do you sort of shift that norm around who's responsible for childcare, who is responsible for unpaid care? And I think pre-pandemic, it was still always largely women being more responsible for childcare responsibilities. And I think that's obviously worsened under COVID. So I think this is a larger question, which is sort of how do you shift those norms and what are different ways to do it? And you're seeing different examples of how to do it. For example, many programs are using sort of household dialogues. This was pre-pandemic, but there's research sort of showing the power of household dialogues, the power of sort of such programmatic interventions to sort of change attitudes and change norms. But I think this is where there's a lot of work that's needed to make that longer lasting change. Catherine, do you want to
Thank you very
something?
much, Shiba.
Yeah.
Yes, Catherine, you have something to add on?
No, I completely agree. I think there's also the broader, some of the evolving discussions in the past has been what the broader role of men and boys in gender equality really is. One, beyond just issue specific focus engagement, right, on childcare or unpaid care work, but really how movements and engagement of men and boys in terms of towards gender equal societies, how that when done should still be should not be centered the focus from adolescent girls and young women themselves, because we still have gender inequalities being prevalent. And so I do in the past, I think the past few weeks, maybe 2, 3, 4 weeks ago, there was a Men Engage Ubuntu symposium where there was quite a lot of robust conversations around how do men and boys partner with women's rights organizations, accountable to those principles set out, when discussing GBV, how do you ensure that there is no dichotomization of even men encounter GBV and, create false equivalencies and things like that. So I think people are having much more contextual, nuanced discussions, and that's good. I personally think that it's a continued push that we all want to have gender equal societies. So it is inevitable for men and boys to be engaged. It's just that now we are getting to the how do they get engaged, because they're part of the movements, right? We do have quite a few of them in the work that we do, but how do we make that work more transformative and really reflect on the structural ways in which patriarchal society is ordered, right? In terms of rethinking power, rethinking gender power relations, rethinking representation in spaces where adolescent girls and young women are articulating their issues and articulating their concerns and priorities. So I think that's happening. It's happening at different levels, and there are quite a few allies and quite great programs that have shown results, like the SASA program on GBV is a really good model of how to effectively engage men and boys while ensuring that you're still disrupting patriarchal power systems and advancing gender equal societies.
Thank you very much, Catherine. I know we are also running out of time, but we promise that for the rest of the questions that have come up, we'll be posting them in the CoP community of practice pages so that we can pick on the conversations in that side. So just to note that we have posted a link in the chat box of how you can join the community of practice. Kindly please just click it and have a look at it, and also sign up, because we tend to also make sure that everyone is on board during these discussions, and also just to keep it going, as we've said, that the conversations do not stop once the webinar has ended. We want to keep the conversations going on. So as we wrap up, I think I can call back on Apar to come and tell us what's the way forward now, as we have come to the end of this engagement, and how we move on forward from this point.
Yes, thanks, Sheila. We would have liked to do this little activity on a Padlet, but I know that we are kind of running out of time. So what I'm going to do is I'm going to put this link over here and request everyone to take their time and add whatever your plans are, whatever your organization's plans are for the Generation Equality Forum, which is also Gender Equality Forum, because I know that different organizations are doing different things. So we just thought it'll be good to hear from all of you, especially members of the communities of practice and other youth and youth serving practitioners, on what your plans are, so that we could reach out and coordinate. We're also going to put this Padlet link on the community of practice discussion group. So as we keep re-emphasizing, please do join the communities of practice on the youthpower.org website. And yeah, we can take it from there. Giving it back to you, Heather, to conclude.
Just thank you so much to Shuba and Catherine for the very interesting presentations, and also for everyone joining for the lively discussion. And let's continue this conversation online, and stay tuned for our upcoming communities of practice meetings in the coming months, where we're planning also to do another joint one between youth engagement and gender community of practice around Pride Month. So stay tuned. And then we'll also have, of course, some other meetings in May. So thanks so much to everyone, and stay tuned and stay involved.